Welcome back to the channel. Today we're talking about a condition many people haven't heard of but should know about: pernicious anemia. Pernicious anemia is a type of vitamin B12 deficiency caused by an autoimmune problem. Instead of absorbing vitamin B12 the normal way, the body attacks parts of the stomach that are needed to take B12 in. Without enough vitamin B12, your body can't make enough healthy red blood cells, which means less oxygen is delivered throughout your body. What makes this condition tricky is that it can develop slowly. Someone can have pernicious anemia for years before realizing something is wrong. If it's not treated, it can lead to serious complications, including long-term nerve damage. So how does this condition affect the body? Low vitamin B12 can impact several systems. Some people experience digestive issues like nausea, bloating, or unintended weight loss. Others notice fatigue, weakness, or heart palpitations. Over time, the nervous system can be affected, leading to numbness or tingling in the hands and feet, balance problems, memory issues, mood changes, or even vision problems. Who is most commonly affected? Pernicious anemia is more often seen in older adults, especially between the ages of 60 and 80, and it's more common in people of Northern European descent. However, it can happen to anyone. Symptoms can vary. Early signs might include constipation or diarrhea, shortness of breath during activity, lightheadedness, pale skin, heartburn, or a sore, swollen tongue. As vitamin B12 levels stay low for a long time, symptoms may worsen and include confusion, depression, trouble concentrating, numbness, or balance problems. It's also possible to have pernicious anemia without noticeable symptoms at first. That's because the body stores vitamin B12 and uses it slowly. It can take years before those stores run out and symptoms finally appear. So what causes pernicious anemia? It happens when the immune system attacks the stomach lining and blocks a key protein called intrinsic factor. Intrinsic factor is necessary for vitamin B12 to be absorbed in the small intestine. Without it, vitamin B12 from food can't properly enter the bloodstream. Other things can also contribute to low vitamin B12 levels, such as stomach or intestinal surgery, digestive conditions like Crohn's disease or celiac disease, bacterial overgrowth in the intestines, certain medications, tapeworm infections, and diets that lack enough B12, especially vegan or vegetarian diets without supplementation. How is pernicious anemia diagnosed? Doctors usually start with a physical exam and blood tests. These may include checking vitamin B12 levels, red blood cell counts, and markers that show how well the body is using B12. In some cases, tests are done to look for antibodies or changes in the stomach lining. Treatment focuses on replacing vitamin B12. Since absorption is blocked, many people need B12 injections at first. Once levels improve, some may switch to high-dose oral supplements. Treatment is monitored closely, and most people begin to feel better within days or weeks. For many individuals, vitamin B12 supplementation is lifelong. While the condition itself can't be cured, proper treatment can greatly reduce symptoms and prevent further damage. However, nerve-related symptoms may not fully reverse if treatment is delayed. There's no guaranteed way to prevent pernicious anemia, but being aware of risk factors and symptoms can help with early detection. If you feel unusually tired, weak, or notice neurological symptoms, it's important to talk with a healthcare professional. Living with pernicious anemia means staying consistent with treatment and follow-up care. Some people may also benefit from eating foods rich in vitamin B12, such as fortified cereals, meat, fish, eggs, dairy products, and fortified plant-based foods. Early diagnosis matters. Catching this condition before serious nerve damage occurs can make a huge difference in long-term health and quality of life. If this video helped you understand pernicious anemia a little better, subscribe to the channel for more clear, easy-to-understand health information.